Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on mentors and motivators who are consistently reshaping, redefining, and rediscovering the field of medical healthcare. I would like to welcome Raun Kaufman, author of the book Autism Breakthrough, the groundbreaking method that has helped families all over the world. Through the development of the Sunrise program, founded by his parents, Mr. Kaufman was able to recover from his childhood diagnosed autism with no residual traces and currently serves as Director of Global Education for the Autism Treatment Center of America. Raun, it is such a pleasure to have you joining us today, right off the keynote stage.
Well, thank you for having me. Thank you very much. I appreciate it.
You're welcome. So your story is quite extraordinary, and I went through your book a bit. I heard some of your keynote. I am blown away because just the little I know of you, I am baffled. So
what
my
are you baffled by?
understanding, is that you were diagnosed at 2 years old with severe autism, and today you seem 100% social, brilliant. You don't seem to have any manifestations from what my understanding is of somebody on the spectrum.
Yeah, your understanding on both those fronts is totally correct.
Okay.
I was diagnosed, as you said, with severe autism. I mean, I had no language, no communication, no eye contact. My parents were told I had an IQ below 30. I would spend my days doing repetitive behaviors that are very common to our kids, rocking back and forth, flapping my hands. One of my favorite things to do is to take a kitchen plate, put it on its edge, and spin it like a top over and over again. And my parents were told, hey, not just that I had severe autism, which was the diagnosis, fair enough, but that they were given a really intense prognosis, someone's guess about the future, basically, which was, he's never going to talk, he's never going to have friends, he's never going to be able to relate to people, and he's certainly not going to grow up to graduate from university or fall in love or have a job that he likes or anything like that. And my parents did something truly amazing in the face of that, which was they really turned their backs on these sort of dire predictions. They took me home. They developed their own home-based, very much child-centered program. They worked with me for a little over 3 years. And at the end of that period, as you were highlighting, I don't have any remnants of my former autism. It's pretty amazing, actually.
So you were developing normally from birth to 2?
There was actually a lot of stuff that went on with me. So I was getting, at a very young age, I was getting pretty severe ear infections. I almost died from one of them. I then had an allergic reaction to the antibiotics they gave me to help the ear infection. There was lots of stuff going on. And then between 1 and 18 months, things started to also then really change.
Had you been verbal at that point? Had you said your first words? Had you said mama, dada?
I had said a couple of words. I wasn't speaking or anything.
Okay.
But I was somewhat interactive. But I was also really, when I was a baby, I was just a almost 24 hours crier. So there was lots of things, there was immunological and other things going on with me. That was pretty clear. And then, at 18 months, I really retreated into my own world in a pretty profound way.
It's a lot to comprehend.
I really hear that.
So what did your parents do for a living?
Oh, well, it's interesting. So although my dad had a degree in psychology, he was actually an advertising exec for Hollywood films. Actually, he did all the Redford and Dustin Hoffman films of the late 60s and early 70s. And my mom was a sculptor. And they weren't, here's the thing that is amazing, they were not at all in the field of autism. And it's something I'm deeply grateful for, because it allowed them to come at it from some totally outside the box and just see me and what was going on with me versus some sort of clinical idea they'd already had in their heads of this is what autism is and this is what it's supposed to look like and this is how the trajectory is supposed to go.
So they challenged that. So
they did.
But my understanding as well is that they had gone through some self-development program in the early 70s or whatnot that was very common back then, self-help kind of thing. So did that give them the capacity to have the patience to deal with you at that point?
That is very astute what you just said, because actually that's a really important part of the story that most people aren't even aware of. They did do some sort of personal development stuff, and actually they ended up developing their own, which they still teach, their own something called the option process. But it's basically a way of looking at how we're viewing something and how the beliefs that we're coming to something with affect completely how we feel and what we do. It's not that crazy, right? But they really used it to work on their own things, their own hang-ups and whatever. And actually, they completely credit that with why they were able to deal with me the way that they were. So they're, I'm behaving in all these really different ways. They're getting these really intensely pessimistic messages, and they're able to sort of step back and go, actually, number one, these messages are just somebody else's belief. It's not like the truth of the universe. They're entitled to their beliefs, but we can see this differently. And even just the view of autism, my dad tells this great story of like this doctor trying to really be nice, putting his arm around my dad, and they're watching me like going like this on the floor, right? And the doctor's going, I'm so sorry. This is terrible. This is such a tragedy. I'm so sorry, sir, right? And he's trying to be sweet, right? And my dad is actually thinking, hey, I never want to look at my son and think how terrible, what a tragedy. And this is what my parents did. They started, this is what enabled them actually to develop the Sunrise program, was first they were like, look, we're going to start by really enjoying and loving and being excited about the kid we have right now.
You were a gift from God, and this is.
And they weren't gonna sort of put over these expectations of what a child is supposed to be, what I was supposed to be. With a lot of people, they quote mourn the child that they thought they had. Right? My parents really didn't do that. It's not like they knew, and by the way, it's not like they knew I was going to recover. It wasn't like, oh, we're going to develop a program. It's fine.
They didn't go into this developing a program. They went into this to try to help their child and spend time and try to bring you into their world, but by joining yours in the process.
Yes. Okay. In fact, even before, before they were trying to bring me into anything, they were more just like, how do we
communicate?
How do we relate to him?
Okay.
He's in his own world. How do we build a connection here?
So what did they do?
Well, actually, so one of the first things they did is, and we still do it as a first step, it's the most controversial thing, actually, which is rather than trying to force me to conform to their world, they joined me in my world. So remember I told you I would take plates and I would spin it on its edge, right? And my parents were told, hey, first thing you've got to do, you got to take the plate away, you got to tell them no. I mean, and by the way, I'm telling you the sort of nice version, because actually, this was in the 70s, they weren't just telling these kids no. They were shocking them with electric cattle prods. They were tying their wrists to the arms of chairs to get them to stop flapping. So like things we would consider deeply inhumane now. And so they're telling my parents to do this, right? And my mom is watching me spin this plate, and she's like, how do I like show him that I love him, that I'm with him? And so she gets a plate of her own. She sits down next to me, and she starts spinning the plate, getting really into it. And that was the first time I ever looked at her.
Right.
And so you're tearful. What's going on?
It's very hard. Yeah. Wow. I'm trying to imagine what it must be like for your mom to try to get a laugh out of you at 2 or however 18 months. Or how old was this at that point when they decided to do this?
Well, they worked with me all the way from a little before 2 till I was 5. So they.
But the first time that they got down on the ground and spun the plate with you.
Yeah, this was about 20-something months, yeah.
So, you look for that reaction from your toddler child. You want that recognition when you walk into the room and they, their eyes light up. You want so I can only imagine just the sheer bliss that your mother and father must have had the first time you reacted to them getting on the ground with you and spinning that plate.
Yes.
So, for you don't have memories of that time, I'm assuming.
Not that piece. No, no, I don't. I wish I did. I really wish I did.
But I'm sure your parents have that embedded in their memory.
Of course they do. Yeah, absolutely.
So what if your parents told you about that time, the first moments that you acknowledge their presence?
Yeah, well, my mom's told me about it many times, and she's because she was doing a lot of this day-to-day work with me, and it was. I'm so glad it's touched you this way, because it was really profound. People can think of it as just like a really useful technique, like in a sort of an academic way, but it's so much deeper than that. So yeah, she said, she was coming from this place first of trying to show me, not trying to get me to do anything, trying to show me, I love you, I'm here with you, right?
Unconditional love.
Yes. And then when I reacted, it was so touching to her, because it was like, again, she wasn't thinking, oh good, now he's going to learn some skills. She was like, he sees me, he sees that I'm with him here. And it was really, really beautiful. I've always I'm really close with both my parents, but I've always had such a connection with my mom. And, you know, I'm so grateful because it's like the way everyone wants to be loved, but hardly anyone's ever loved that way.
Most of us are saying, stop playing with the plates, get off the floor. You know,
Absolutely.
It's right.
And no one's saying that with a bad intention, right?
Right.
Everyone's trying to do their best and trying to help their kids, but the focus is on how do I get this kid, or even my husband or wife, how do I get them to do what I want? How do I get them to do what I want, right? And so I'm not even saying that that's a bad thing to think that, but because that becomes the focus, you're ending up, number one, you're kind of disrupting and breaking the trust and relationship part, and you end up creating a kind of adversarial relationship when I know that's not anyone's intention.
So take us through the program. I'm assuming that the majority of the people that come to participate in the program, are they starting out at approximately 2 years old?
No. Oh my gosh, no, I'm glad you asked that. No, actually, I mean, we have some that are 2-year-olds for sure, but we have 2-year-olds, 12-year-olds. We have a bunch of people in their 20s and 30s,
and the
teenagers.
Same philosophy of the program about joining them in their world applies to no matter what age they're in.
Yes.
Wow, okay,
yes.
So can you please go into that?
Of course, yeah. So, because here's the idea. The whole idea is we're entering their world first, and we're starting where they are, and we're building. The people have called our joining technique mimicking or mirroring. It really isn't that. We're not trying to show them that we can copy them. They don't care. We're trying to show that we love what they love. We love what they love, right? And this is actually how, it may seem new to autism, but it's how human beings have been relating for thousands of years. This is how human beings trust each other. This is how ancient tribes got together. I mean, this is deep in our brains about how interpersonal connection works. Right? It's so funny because people are trying to help kids who have a social relational challenge, which is at the center of autism. They're trying to mostly help them by actually doing things that I would call antisocial, right? That are sort of teaching them the opposite of this. But to come back to this, so it's all ages. Now, all these kids and adults, they're doing different things, right? They're not all spinning plates like I was, or they're not all flapping their hands. So we're getting into what they're into. So if someone's lining up little cars, we're doing that. If someone's repeating their favorite line from a movie, we're doing that. And if someone has Asperger's syndrome and they're highly verbal and they're not hand flapping and they're not lining up cars. Some people say they don't have repetitive behaviors. They do. It looks different. What they do is they have subjects they love to talk about. So maybe they love airplanes and they can tell you the
hyper-focused on something.
Yes, could be that. I talked to a kid recently who was really into toilets, knew how the flushing mechanisms worked all over the world. It was actually really cool. And everyone, even for those people, is like, oh, okay, let's move on. Grandma doesn't want to hear about, right? And so everyone's doing the same thing. And what we do, and this is a great example of how it's not simply mimicking, is we don't just repeat back to them. We actually first, with those kind of kids, we listen with great interest.
You find out about how the toilet works.
Yes, that's exactly right.
Okay, so let's go back to your youth. So this process took approximately 3 years?
A little over, yeah.
Okay. So at what point did your parents say we're onto something?
Oh, that actually happened really quickly. Because still, even when they were onto something, didn't mean they knew where it was going to end. But they knew they were making a connection. Because remember, that's the thing they were trying to do at the beginning, right? So yeah, that was happening. That happened within a couple of months because they started to notice, holy cow, he's really looking at, he was completely cut off from us and engaged in his own world. And now he's like starting to show interest in us for the very first time. So as soon as they knew that, they kept going down the road they were going.
And you had siblings at the time, or you didn't?
I had 2 older sisters. Okay. Yeah, I'm in the middle now, but at the time I had 2 older sisters, absolutely. Okay. And actually, my parents invited them into the program, and they participated in the program even as little girls. It was really
but this
cool.
wasn't a program yet. This was parents and their child, right?
Well, it became a program pretty quickly. Okay. I will say that.
At what point in your 3 years that you were within this program?
Oh, this was like in the first few, going back to the first few months. As soon as they realized they were connecting, they're like, okay, everything. What do we, this is actually a cool thing that also people don't think about, which is they decided one of the key ways to help me was to become a student of my world, like almost like you would if you landed on Mars and you wanted to find out how did the Martians live. So they would follow me around with cameras. They would look sort of like, what does he gravitate toward? What does he gravitate away from? How is he working? What is he like? What is he not like? So they became real students, and as they started to see this helping, they did more, not less of that. And so what they did, and I'll just say one other thing that's a real key for the Sunrise program, because people sometimes think all the Sunrise program is you just join. You just do what the child does. And that's a crucial first step, but it's not the only step.
There's 5 areas or 5 techniques that are involved in 4 different areas? Is that
sort of. There is 4 areas of social development that we focus on according to 5 stages of development. So your numbers are right on. But there's this other piece, I was talking about it actually in the keynote talk, which was, we call it the Sunrise Program ABCs. It stands for Assess, Bond, Challenge, ABC, right? And but this key piece is the first piece, which is assess. And what we're assessing, it's not like an assessment. We're looking at the child every few minutes. This is happening, right? And we're trying to see, my parents did this with me, is this child giving us a red light or a green light? And what that means is, and there's questions we ask ourselves to figure that out in each instance, but a red light is when the child's brain is saying like, hey guys, no es posible for me to take in any new information right now. And those are times when you call your child's name, they don't answer. They're doing a repetitive behavior. They're in that. And most people are trying to use those times to get the child to do something. We realize, okay, there's a red light. The brain's in shutdown. This is not the time for that. Right? Then, though, what happens if we're watching is at other times it'll shift into a green light where the brain's like open for business, and the child is looking and they're not doing a repetitive behavior, and those are times when we can do something. So that's where the B and the C come in. The B is for bond, so all during red lights, we're just focusing on relationship building. And then as soon as we have a green light, we go to the C for challenge, and that's when we are teaching new things. But what it looks like, if you were to ever observe a session, it looks a bit almost like a sort of a dance in this sense. The light's red, then we're joining. Then the light goes green, then we start encouraging the child to play a particular game with us. Then it goes red again, then we go back to joining. Then it goes green. So it's this back and forth.
What's the time span of this? Is this during the course of an entire day, or?
It is, but it's also in the course of an hour. I mean, this is the thing that happens. The child is going back and forth many times an hour, right? This being a student of the child thing that's so important. No one's looking what's actually going on right now with how are they, a lot of people, they have if it's a school or a therapist, they sort of have a plan for the session, which is understandable. I understand that. But what ends up happening is the child's brain ain't matching the plan for the session. So usually what most adults do is say, stick to the plan. Instead of, okay, this isn't matching here. I got to follow where this kid's brain is.
This seems like it's a philosophy for any parent or any teacher with any child at any time, with spectrum or not.
It really is. Right. I've had so many people say that to me, and actually a lot of people, we actually have a parenting course for parents who don't have kids with autism also to help with that. Yeah, absolutely.
It might be good for marriage too. Red light, red light.
Yes. Do you know how many couples I work with every month? It's like really amazing because this is about human relationships.
Right. Connections, exactly.
Yeah.
Okay, so my understanding is that by 5 years old, you were starting to normalize.
Yes. I mean, I wouldn't use the word normalize, but sure, we'll go with that. Yes. So when did life become what we know as normal for you? For me? Well, here's the thing. Okay, a few different things. Number one, I'm now talking as my own first person here, right? Okay. It wasn't like I was like, okay, I'm on the autism spectrum.
Right. You had no idea.
I'm not on the autism spectrum, right? Yeah, I had no idea. Dude, I didn't even know. I just called you dude.
It's okay.
So uncouth. I'm sorry about that. But
we're bonding.
Yeah, we're bonding. We're bonding. But here's the thing. It's really interesting because I didn't even know that my mom was working with me. I was experiencing her as playing with me and like doing fun things together. So this is why I love doing this with other kids. So I was being stretched and grown in a bunch of ways, but that didn't feel the way school feels, right? Didn't have that similar feel. And so then for me, what happened was eventually when I was about 5.5 or whatever, I started going to kindergarten or preschool or whatever. And yeah, I just felt like a regular kid. I was like with the other kids.
Normal
and
friendships,
I made friends.
play dates.
Well, we didn't have play dates back then, but
Okay.
I had play times.
Okay.
Yes. And it was, it's really amazing because I just didn't, I don't think I got the sort of specialness of it, the specialness of my history and of what had happened. I was just like, what's the big deal? Like, whatevs, I'm just doing my thing.
Did you enter school with the administration having knowledge of the fact that you were autistic? Did you still have that label as being autistic?
I did not have the label.
Okay.
You should have seen the faces of some of these people that my parents brought me back to who were convinced I was going to be like this for the rest of my life, could not believe the kid they brought in. That actually did happen. But by the way, my parents said, so look what we did and then look what happened. Maybe you want to incorporate, you're welcome to incorporate anything we did and you do your thing. They had no interest in it. They didn't want to deviate from whatever they were doing anyway. But in terms of your question, it actually varied. So I had times when a teacher or an administrator would know the history, but most of my experience growing up was that they didn't know. They just thought I was one of the kids.
Were there any manifestations at that time?
No. I mean, if you mean like manifestations of autism, I'm going to say no. I will say this. For about a couple of years after my recovery, and this didn't affect me socially or anything like that, but I did have certain interesting sensory things that would happen. So for instance, I would look at someone, like let's say like I'm looking at you right now, and your face would look like I was looking through the wrong end of a pair of binoculars. I don't know if you've ever taken binoculars and flipped them over.
No, but I will have to try it.
Try it out. It's something special. But it looked like kind of small and down like a tunnel. And so the things would look and sound something, it would like shift in and out. By the way, that was not like a traumatic or scary thing for me. It was just something that I experienced. And then eventually, a couple of years after the end of my Sunrise program, that also just got less and less and then stopped. Yeah.
So how many children or how many people have gone through the program today?
Well, I don't know, tens of thousands of families have done it.
And what has the success rate been? Has everybody been as successful as your parents have been with you?
Well, first of all, just a quick answer, no. But let me just say, and I don't mean to nitpick here, I wouldn't use the word successful in that way.
Okay.
Oh, I get that everybody else does, I totally respect that. Because I think there's so many different definitions of what success can be. And I actually really feel strongly about this. I don't think success is having no autism. I mean, look, I love my life. I'm glad about my life. I wouldn't go back and change it. But do you know how many people I know and have worked with who are on the spectrum, love that they're on the spectrum, bring really unique thoughts, talents, and ideas to the world? I'm not trying to rid the world of autism. I don't think it's some scourge and terrible thing, right? So I think there's different definitions of success. I would like to see, I feel like it's really amazing when a child or adult can relate to people in a way that feels good to them, can make choices in their own life. So I just want to say that. But I also know what you're trying to ask me, which is, did everybody turn out like me? And the answer is definitely no. And in fact, that's a thing we're really we feel strongly about, which is we're not trying to play God here. We're in either direction, meaning we would never go to a parent and say, your child's going to be deeply impaired in the following ways for the rest of their life, which is what most parents get told before they come to us. But we also don't say, listen, your child's going to turn out just like Raun. We just have every child's different. We're not trying to play God here. We're trying to give each child every single chance that they can get. So to answer your question in more specifics, we have a bunch of kids after me who did turn out like me, who are completely neurotypical, living their lives. You would never know their history.
Graduate from an Ivy League college?
Graduate from college. I don't know if they went to an Ivy League college. By the way, one of those people is my niece. My niece is 22. You might think we share genetic material. She was adopted, right? Adopted at like 3 weeks old. 2 years later, turns out to be on the spectrum. My sister and her husband, and I was part of it too, do a Sunrise program with her. Now she's 22, has a really serious boyfriend who just adores her. His whole family adores her. And everything's going great for her. I mean, it's really amazing. So that is possible. That's one of the outcomes. I want to be really clear though, there are also plenty of kids and adults that we've worked with who definitely are still strongly on the spectrum. But what's so great is that they've been able to make these changes that are so far beyond their original prognosis of they're never going to be able to talk or relate to people. There's a lot of doors opened. And also there are some kids we work with that just move really, really, really slowly. I've never seen anyone like not improve at all, but I've seen a few that just, they're plotters. They sort of move at a certain pace, and that's why we start with parents. We're not trying to sort of give them some sort of snake oil, like do this, do these techniques, everything's gonna fix itself. We actually focus a lot of energy on helping parents get deeply at peace and comfortable with where their child is, with not needing their child to be a different child than that child, and then let's see where they go from there.
So was there anything that your parents did, or is there any component of this program that has to do with diet and any, alternative therapies as regards?
Absolutely,
okay.
absolutely. Actually, so I have a whole chapter in my book on it. But the other thing is that my parents, most people don't know this, my parents were one of the very first parents on earth to do dietary interventions for autism. Right? People thought they were, it was crazy at the time. Right now, it's like much more mainstream. But yeah, I was getting life-threatening ear infections. They took out dairy. That immediately stopped. They took out dairy. They took out artificial colors. They took out sugar. They took out red meat. They did not take out gluten, which is very common to take out now. They didn't take out wheat. But back then, number one, the wheat was really different back then and much less glutinous. But two, no one knew. No one had any inkling that it wasn't the healthiest food in the world. But they did a lot of dietary intervention. Really helped me from a health point of view.
Did you bring any of that back in when you normalized?
See, I'm going to say it this way. Unfortunately, yes. Now, most people would say, well, unfortunately, isn't that great? Well, yeah, look, I always find this hilarious, right? Because we do help parents implement dietary interventions to help their kids. And a great thing about the way we do it is that we do it, we show them how to do it with their child's willing participation. So they're not forcing it. They're not forcing something down their child's throat that the child doesn't want. Right? We're always doing stuff with the child. We're never like going against them. But this is why I bring this up. So parents then ask me, how long do I have to do this? When can I reintroduce the other foods? And I'm always like, so I just want to be clear, what you're asking me is, when is the soonest possible date when I can rush back into the foods that are going to cause cancer, heart disease, diabetes, and cause health problems, right? So all these things that we're taking out, it's not like these are deeply good for you foods, right? So I say, unfortunately, yes, I don't have a great diet. I just eat whatever's in front of me, and it doesn't make me go back to being on the spectrum.
Right.
Yeah.
So is there anything today that you would say would be even the slightest little nuance that could suggest that there's something still
within my physiology?
Yes.
Well, I definitely don't think there is anything within my neurology for it. I just live in my life. I even had a brain scan where they were trying to see if there was something different from that, and it came out normal. They tested me on all these social things. It was pretty cool, actually. But I will say, I can think of one thing from a physiological point of view that I would say I have, two things that I would say I have in common with many of the kids I've worked with, and even me and my niece had some of this in common. One is that my saliva, this is going to sound, this may be TMI here, but my saliva, I think, is missing one enzyme because there are certain foods, not many anymore. It was a lot when I was a 10-year-old, and now it's not so many, but still a little bit, where I can chew a piece of certain kinds of food, like a steak. I can chew it forever and just stays like pre-chewed, just stays solid. Right? So I think there is an element missing. And actually, I remember my niece, sometimes she'd have food in her mouth, chew, and spit it out, and it's like,
wow.
Nobody's chewed it. It's a really interesting thing where it's mashed up, but it's not digested, right? So I have that, but like I said, I used to have it where it was like 50% of meat and half of vegetables I couldn't chew. And now it's almost nothing. It's like a steak and one other food. Really tough meat, basically, is all that's left. The other thing is, I don't know how many of your viewers are familiar with Candida yeast overgrowth, right? So a lot of kids on the spectrum have Candida yeast overgrowth. They really crave sugars. When they crave it, it then causes a reaction. There's a whole cascade of physiological symptoms and issues that come with that. That's the other thing I would say is still a force in my life. Now, it's not a big force. Like I said, I eat whatever I want, but I definitely crave sugar, And whenever I'm like trying to drop a few pounds, so I cut out sugar for a little bit, I have like 2 to 3 days of like flu symptoms, like swollen glands, headache, sometimes a low-grade fever, and then that goes away, which is one of the symptoms of like the yeast is dying because I'm not feeding it the sugar, right? So I have that. I guess I could say that might be related.
Wow.
Yeah.
So is there anything that you do to try to prevent, in addition to reducing your sugar intake, is there anything else that you take? Is there a supplement? Is there something that you do to balance that out?
Look, I wish I could give you better answers. Like I do take vitamins.
Right.
I do take supplements,
right.
but that's more for like long-term health and like
right.
trying to not get cancer later or whatever. I don't take something specifically because of
to reduce the candida. Okay.
Yes, I have. By the way, I have in the past. I didn't. It was intermittently effective, so I didn't end up focusing on it.
Okay, so you went on to study at Brown and graduate at Brown with a degree in bioethics.
Biomedical ethics, that's right.
There's an obvious reason
is.
why you studied, so can you elaborate on that?
Sure. Well, there's several pieces here.
Okay.
Because actually, right, biomedical ethics is the sort of ethics, values, and morality, and that intersection with biology, medicine, et cetera, right? So it could cover everything from genetic engineering, abortion, and euthanasia, to how do we treat people who either can't speak for themselves or have or on the spectrum or whatever. It really affects us because with the Sunrise program, I see 2 pieces to it. There's a practical piece, which is like, I just feel like it's, if you want to help a child relate to people, it's the most effective way to do that, right? But then there's I guess I would call it a moral or ethical piece to it, which is how do we want to treat this little person or big person who is different than us and maybe can't communicate with us everything they want and need and all that? How are we treating that person? And I feel like the prevailing ethics, or at least the prevailing what actually happens, is the idea is we need to get this person to conform to our norms. We need to get them to conform. Stop doing the things that look strange, do the things that look normal, and that's the focus. And so to me, this feels like this is the kind of stuff we would work on this degree, which is like, is that ethical to actually, is that being the way? I know your intentions are good, no one's doing it to be mean, but what's the ethical implications of someone who then they experience themselves being mistreated? That's their experience of it, right? So yeah, so for me, it was that, but then I was also interested in things that have nothing to do with autism.
Do you remember what you wrote on your college application to Brown?
I actually do. I do. By the way, it's so funny in those days. You had to write your college essay in your handwriting. I wonder
remember.
if they had it. Oh, did you apply?
Not to Brown, but yes, I did write it.
They wanted to like see your handwriting. I
Right.
thought that was fascinating. I actually wrote about I actually did write about my story. I didn't just say, hey, here's what happened to me, but I said how that affected how I view things that I approach now. Like, for example, how I really don't. It's really made me realize that sort of anything is possible, that when someone has a limit, that's actually someone's guess about the limit, and that the biggest thing that limits me is like I'm my own biggest limiter, right? And so it's really affected that. It's also affected how I treat people and how I view other people who might function differently or want something different than me. So I took that and then I applied it to how I approach things now, and I guess it worked, right?
Where do you see the Sunrise program developing over the next 5 or 10 years?
That's a really good question. I'm super excited about a couple of new things that we're doing. So we have the Autism Treatment Center of America. It's a nonprofit organization. That's where we do the Sunrise program, and it's a huge campus, 100 acres, 12 buildings. Wow. Yeah, people come from over 100 different countries, and we provide then. We just include housing and food, so they just need to get here, right? And normally what happens is people come for a week at a time, and there's different things they can do. The first thing they do is called the Sunrise Program Startup, and it's basically a week-long program with a bunch of parents and some professionals. They come without their child to that one. We teach them how to do the Sunrise Program, they go home. It's the amount of, the difference in people from the Monday to the Friday is startling, even before they've used it on their kids yet. It's really amazing. There is also a program where they do bring their child, and we work directly with the child in a one-on-one way and directly with the parents. That's also a week long. There's about a 1-year wait list for that program. But so that's been going on for a long time. We've been doing that. That's a model where we're always going to have that in some form. But two things that are really cool. Number one, we took that program, the one that parents come to without their child, and we created this really fun, cool, interactive online program, including with a little animated boy with autism who shows them some of the techniques. It's so cool. It's really, really fun. I spent 2.5 years of my life on this with the other teachers, so it was like, it consumed my world for a long time, and it just came out last fall. And people from, just since last fall, over 61 countries who couldn't get here, either couldn't get visas, couldn't get to our center, they're able to do it from where they are, and then they do it, and then they write us what the changes they see over the next few months with their kids. It's crazy. It's awesome. So that's one thing. We're going to do more. We're going to reach out more online to people. And the other thing we're going to do is create a situation where we're going to create a new system where we can train people, not the families, but people who then can go help the families. We've been training people for decades, but we train people to work at our center. So now we're going to work out a different way where families, wherever they live, can have someone near them who at least knows the fundamentals of this.
So you just got off the stage and you spoke to a room of a few thousand medical practitioners. Mm-hmm. What do you think is the single most important message that you delivered to them, for them to take back? This is a brain awakening conference.
Yes.
So some of them are general practitioners. You've got, you have physicians from all over the specialty spectrum, so to speak. Yeah. So what would they bring back to their practice, whether they're on Monday morning, whether they're dealing with a 2-year-old with potentially having autism, or an 18-year-old who's also on the spectrum? What do you think would be the single most important?
Can I say two messages?
You can say two.
I was trying to communicate a couple of messages. One is, it's really important, no matter where someone is, and diagnosis is very important, of course, no matter what they have. But no matter what that diagnosis is, not to turn that into some written future for that person. We just don't know what they're going to be like. And what they did yesterday actually tells us nothing about where they're going to be tomorrow. Nothing. So the first thing is to sort of, I'm not just talking about like believe in the person and say they're going to go. I'm actually talking in a way about the opposite, about taking away any attempt to predict what that outcome is going to be, and just take the diagnosis seriously, of course, and then do everything you can to help them reach their potential without you being the person that's limiting them by like, oh, I think I can help them do that, but they'll probably never be able to do this. We just don't know that. So let's give that person an actual chance. And the second thing has to do with the actual approach to the person. I focused a lot on both red lights and green lights, and also on joining. So this idea of seeking the relationship first, seeking to get into the person's world first. I'm sure they have lots of things they want to help their patients do it, and that's appropriate. But I'm not saying to abandon any of that, but to start. Most people skip this first step. They get right to what they want the person to do, and they don't spend the time on the actually building the connection so you have the trust so the person will actually do it.
Remarkable. So tell me about your personal life. So you're on the road a lot.
I am on the road a whole lot.
So we've had some communication over the last few months.
Yes.
You are extremely hysterically funny.
Thanks.
You are welcome. You're clearly brilliant. So have you been able to share this when you're not talking about the Sunrise program, and when you're not talking about what you're doing professionally? Are you just a normal guy? Like, you're just a normal guy. So what's your personal life like? What do you do in your spare time? What are your hobbies?
Okay, well, a few different things. Actually, you complimented my jacket, and actually, I was going to tell you when I first got this jacket, I bought it specifically to go to swing dances. So one of the things I do is do swing dancing. It's a lot of fun. I've gotten into painting, which I'm usually not that artistic, other than, well, I'm very into writing, but not visually, and so I've gotten into painting lately. That's really cool. I love to write. I'm a big yes.
Do you write?
Yes.
What else have you written?
Well, I've written a lot of articles.
Right.
I'm actually working on something fictional at the moment too. I really love writing fiction too. But also I just like, I love going bowling with my friends or watching a movie. I just feel like I, as you correctly sort of hinted at, I don't really take myself or situations very seriously. So I'm usually kind of joking about something. And I would just say, because maybe people are wondering, and I'll tell you an interesting insight about what I'm about to tell you, which is, so I'm not yet married, don't have kids. That's not a philosophical point of view of like, I just don't believe in. I actually, all through my 20s, really wanted to get married and have kids. I had some amazing girlfriends that I feel really grateful for all my past relationships, really. I just had some great people in my life. And got really close to marrying a couple of them. It didn't happen that way. I think, so I'll just talk about the elephant in the room for a second, because I have, when I was 32, and I'd be traveling around to conferences, and parents would often ask me, are you married? And I would say, not yet, right? And they would be like, you'll find her. You know, right. like really encouraging, really great. And then as soon as I hit my late 30s, something changed. They would say, are you married? I'd be like, oh, not yet. Interesting. Interesting. Right? So there, I guess, connecting it in some way to my past. Okay. Right? I will just say I don't have difficulty with relationships, right? It's just, that's obvious. Just because I haven't put a ring on someone, right? Or they haven't put one on me. And your parents were
great role models.
They were great. They're still married, right? Here it is for me. I work, part of what I do for a living is I work with couples. And so I see all the stuff that comes up between them. And I feel like I just really have learned from them, actually, the importance of being choosy about who you're going to spend the rest of your life with. So it's not something I have no interest in, but it's something that I really want to, I'm not just trying to close the deal to be married. I don't think there's any point to that. I only want to be with someone that I really feel like we're going to have a wonderful life together. We're going to be able to talk about everything. And so for me, I'm happy to wait. I'm not in any rush for that. It'll happen when it happens. I'd love to have a kid. That would be great. But it's not I trust it'll happen in its own good time.
Getting back to having a kid and the fact that about the genetics and whatnot. So is there a genetic component? Isn't there a genetic component? I know your niece obviously was adopted, so there's no genetic component, at least to your sister and brother-in-law. Right. Do you know anything about her birth parents or anything?
I don't know. Okay. I don't know much there. But here's what I would say. What I feel like a lot of the evidence points to, because I think you're asking a larger question, which is a really good question, is I don't think it's not genetic the way like, Huntington's disease is genetic, right? But what it is I feel like the part that's genetic is whether you have a really sensitive person, right? Sensitive immune system, sensitive nervous system.
Compromised, right?
Yeah, but not actually. I wouldn't say. I don't know that I'd use the word compromise. I would actually say sensitive. I think back, 1,000 years ago, 10,000 years ago, you want a person like that in your tribe. You need a person like that. This has evolved in the population for a reason, right?
Okay, I was talking about immune compromise, not compromise, meaning that there's limitations to that.
No, I know, but actually, this is my point. I actually don't see it even that sense as immunocompromised. Okay. What it actually is, this is my understanding of it, is it's immune sensitive, and then what happens is because of different things that are introduced to them in our modern environment at a young age, and they react to different things, could be food, some people react to certain medications that they get, and then they become toxic. Immunocompromised. Okay. That definitely happens, right? But there's been a huge increase, as you know, in the rates of autism. Huge. When I was a kid, it was 1 in 10,000. Now it's 1 in 68 and 1 in 42 boys, right? So why is that, right? You can't have that kind of increase in a couple of decades if it's just genetic. So what seems to be is you have the same number of these really sensitive kids, right? Really sensitive and brilliant kids, actually, but you have a much greater percentage of that group that's getting sort of what you call like an environmental insult or an environmental trigger in the first 2 years of life, because it has to be pretty soon. It's not like some 15-year-old something can happen and now they're on the spectrum when they were previously neurotypical. We've seen 0 cases of that, right? It's that if something happens in the first 2 years, once in a while, 3 years of life, and then the body has a big response to it, I actually think the people that are calling like the symptoms of autism, the behaviors, is actually not the autism. It's the child's response and coping with the autism. The autism is happening underneath that in the brain, in the nervous system, et cetera. And so so that part, so the sensitive part is genetic, and then I think the autism part is whether it tips the scale there. That's environmental. So like if you're asking me for my kids, yes, I know I have that genetic predisposition. What that means is I'm gonna be really careful those first 3 years. Now, by the way, when I say careful, I could have a kid could end up being on the spectrum too. I'm not dreading that.
So this is the real elephant in the room.
Yeah.
What would you do about a vaccination at 2 years old?
That is a great question. Here's the thing. Let me just say this, because I've been with the Autism Treatment Center of America for 20 years, right? And I sort of feel like I've learned a lot over that period of time. And one of the things is that for what our mission is and what my mission is personally is helping the kids who have autism right now. So the reason I tell you that is like, to me, it feels deeply unproductive to our mission for me to weigh in on that. Okay. Now, I will say this, have I worked with parents that have told me and even shown me video footage in some cases of that their child was developing normally, and the only thing that they saw, that they could see was different, was the child got a vaccination, they had a bad reaction to it, and then their child lost all their language or whatever. That has I work with those parents, those are some of our parents. We have other parents whose kids have never been vaccinated, right? So that happens too, right? So I just don't know who it helps. There's so many other people weighing in on that. It doesn't need my voice.
Very good. Okay, so let's talk about your book and your mission when you wrote this book.
Well, okay, so this is interesting because, if you had asked me 20 years ago, I would have never, ever guessed that I would write this book, actually. Because actually 25 years ago, I wasn't going to even go into this field. But this has become such a labor of love. I have to tell you, it's funny because they also made an audio book of it, and they had me be the narrator.
You have a voice for radio, by the way.
Oh, thank you. I have a voice and a face for radio.
Right.
Yes. But I did the same. The reason I'm bringing that up is I did the same thing when I was doing the audiobook as I did here, which is I literally would close my eyes and I would imagine I'm sitting next to a parent who just loves and adores their kid, and we're having a cup of coffee together. What would I say to this person? If I really wanted to help, if I wanted them to leave that conversation and be able to go and help their kid, what would I say to them? So that's how I wrote it. Like, I didn't write it like a sort of textbook or an academic book. I wrote it like a conversation. And so actually anyone who's ever talked to me, it's like written in the same language I talk in. And I just wanted to give, I realized there was actually, at the time, before I wrote this, there was some great books like Sunrise, The Miracle Continues about my story, and another one called A Miracle to Believe In that my dad wrote about another family story. But there was no manual. There was no book that said like, hey, here's what you do first, here's what you do second, here's how to do it. So I wanted to write kind of a manual in that way. And it was really fun. Because I also got to tell all the little stories of all the different families I've worked with. At the end of every chapter, there's like a little worksheet to help you put it into action. Actually, each chapter also has a separate connected web page that has videos and other stuff to help you with the material in the chapter. So I put my whole life into this book.
That's beautiful. Well, congratulations. The book is Autism Breakthrough.
Yes.
And I'm so thrilled to have had this opportunity to spend time with you.
Oh, thanks for having me. I really appreciate it.
You are welcome.
You asked great questions.
Well, thank you. Yeah. Thank you.